Good morning and welcome to the Senior Hour, which is sponsored by Santa Clarita In-Home Care and Advanced Audiology. I'm Barbara Cochran with my co-host Dr. Jean Dorio on your hometown station AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our guest this morning is Dr. Marwa Kalani, a palliative care doctor. Welcome.
Thank you so much.
And
nice
Jean, yes, and Jean is stuck in traffic.
Yeah.
Something about an overturned
RV.
somewhere on Soledad Canyon.
Somebody probably having a leisurely vacation and took a hard turn.
Absolutely. That's the only thing I could think of that would cause one of those to turn over.
Yes.
Because they're so top heavy.
Yes.
So, what are we talking about today, Doctor?
Well, and I wanted to run it past Gene first, but since he's not here, thought about maybe talking about geriatric emergency room services for our growing senior population.
And it is growing.
Yes.
Really, really growing.
Yes.
Really growing.
The problem is that our emergency rooms are packed with lots of people. A lot of people are getting their primary care services through our emergency rooms.
I know, and that does not make any sense to me, but
No.
they cannot afford the insurance.
They either can't afford the insurance or the availability of providers outside of the emergency room are limited.
That's quite possible, yes.
And I know at our hospital at Providence Holy Cross, it's a constant problem where people with urgent care needs are presenting with emergency care needs. So it was a very interesting article that I saw on CNN.com in regards to the budding of geriatric emergency room facilities. Not necessarily a standalone geriatric ER, but a particular carve-out within an emergency room where they would take care of geriatric specific needs.
Yes, already existing emergency room.
Exactly.
That's very interesting because many times you go into an emergency room, and I've done it. I've taken my husband there.
Yes.
And the place is absolutely packed to the point where they're in the hallways.
Yes.
And so many of them, like my husband, when I had to take him in, he's a senior,
Yes.
but he had to wait in the hallway.
Yes.
And that's ludicrous. It really is. But I agree with you. We need to start making some kind of accommodation in the existing emergency rooms for seniors who come in with many times very, very desperate needs to be taken care of.
Right.
And they're put in line like everybody else.
Right. Or even situations where, when you're going into an emergency room, it is so chaotic. And especially our local emergency rooms are both trauma facilities,
Right.
both at Providence Holy Cross and the one
Mayo.
locally here. And it is loud. It is not an environment necessarily for the two ends of the spectrum of patients, the pediatric patients and the geriatric patients.
That's exactly right.
And it would be nice to see how a geriatric focused emergency room would play out in regards to the quality of the care and the attentiveness, and whether or not it would actually result in sending more patients home rather than necessarily admitting these patients when they may not need inpatient level care. But if they could get their needs addressed in an emergency room setting and sent home, that I think is the ideal.
Yes, that would be. Now, what would we have to do to get something like this started in our local hospitals?
Right.
Providence Holy Cross, the one in Henry Mayo.
Right.
What would we have to do? Sign petitions, march down the streets, protest with banners. I mean, I've done all of that
I
myself.
know you have. Oh my goodness. And we could talk about the other topic that you talked about just right before the show.
Yes.
But I think one of the things that we need to do is first make an assessment as to where our population is at. Who is our population most vulnerable? And as well, figuring out the demographics and the dynamics and really doing a proper assessment. This article came out of Mount Sinai Hospital in New York City. And Mount Sinai has been a leading geriatric center in the country, possibly the world.
Wow.
And as well as palliative care. And in fact, the Center for the Advancement of Palliative Care stems from Mount Sinai School of Medicine.
Interesting.
So, if they're kind of setting the pace, we should start looking at it as well. So it's a very interesting article. If anyone would like to look into the health section on CNN.com, it is available for you all to read. But it does discuss things such as, simple things. And I'll tell you, I had a patient that, I just came back from the Disney cruise.
Oh, wow.
And we were away. Of course, there is no connectivity on the cruise ship.
No, none at all.
I think they do that on purpose. But it did leave me kind of harried, but whatever. So I had a patient who has been utilizing home care only. Palliative care at home. She does not want to go to the clinic. She does not want to go to urgent care. And she's 93 years old.
Ooh.
She is a beautiful woman, very active, but has some dementia. And she had a little scrape, and she needed some attention. And unfortunately, because I was not available, she had to go and utilize emergency room services.
Oh,
but it was a minor thing. But imagine the visit that she had to go through in order to get the services she needed.
Yes. She probably had to wait
She sure
quite
did.
a few hours, which is,
And that's just not worth it.
And it's not fair.
No.
It really isn't fair to have someone 93 years of age who needs medical attention, that she has to sit at the end of the line and wait 4, 5, sometimes 6 hours to get care.
I know. And I
In
mean,
an
she walked away
emergency
with
room.
like a simple Band-Aid and some oral antibiotics, which could have, I could have done that at home had
Had you
I
been
been
there.
available.
That's right. But you were on a vacation, which you are
Right.
entitled to.
Yeah, but see, like
So-
a geriatric emergency room provider would be able to address those things
That's right.
because they know what that population needs. We're talking
That's
about,
right.
Dr. Dorio just walked in. We're talking about the concept of a geriatric emergency room.
Picked up a piece of that, and just to clarify, the
Yeah.
RV wasn't turned over.
Oh, it wasn't?
No, it's pretty hard to do that. You're right. Unless it's going over a cliff, we don't have too
Well,
many
no, unless it's
on
taking a
Soledad.
turn too fast, it could tip over
Looked like it was
sideways.
coming out of McDonald's. So, and it was stuck in the middle of the road, and they said it's been there since 8:30. So I didn't
Stuck in the
yeah.
middle of the road.
It's just sitting out there like a sore thumb.
Then why isn't someone doing something about it?
I would think, but they're probably logistically, just like trying to get a geriatric physician, logistically it's not possible. But going back to that topic, I heard some of it as I was sitting in traffic, and I thought that, one of the problems we're having is access of care.
Yes.
And
Oh my
we
goodness.
really have not had enough physicians for a long time. There's such a huge shortage here in the United States. But, that was anticipated, I believe.
Mm-hmm.
Many years ago, as I was coming in 35 years ago into the practice, they were being told, they're limiting the number, supply and demand. The less doctors, the more demand there will be for you. But, that's pretty much worked against the medical community and the public as well.
Mm-hmm.
And certainly, we need more physicians, but I don't think we have a game plan for that. We have a
No.
game plan to have more PAs and nurse practitioners, which is
Yes.
good, but the education level is totally different. Recognition of problems, especially in an emergency room setting, for anyone evaluating a patient has to be at a higher degree.
I
That-
would absolutely agree, and
That-
I've
that-
been hearing more of that is occurring.
Where you have the PAs and the
Yes.
NPs who are evaluating, and that
Yes,
to
and
me
that's
is
bad in my opinion.
that to me is problematic. But I don't sit back and I don't define these problems and then not come up with solutions. I do think there are solutions to these problems,
Yeah.
and just one of them is because we're aware that we have a shortage. I think one of the things we should do is we should fast track those qualified candidates through medical school. Now it takes us 4 years, and 4
Yeah.
years, Mala, that
Yeah.
but that some of that is not really spent well. Sitting in a classroom, we need to learn those things. We can learn a lot of that in undergraduate and then get out actually into the field and practice. So
Yeah.
we could actually cut down that time to 2.5 years, I believe. And
Or at least 3 years.
yeah, and
Yeah.
let's say we fast track some of the people, the nurses who have been around for a while, who have experience and have their desires out there, the nurse practitioners who have the same, and the PAs. Let's say we fast track them into a medical school for 2.5 years, and not only that, but we also find a way to finance that as well for them, because a lot of them they're 25, 35 years old, maybe 40. They're saying, I can't afford that. I have
Right.
family. I have a mortgage. I can't do that.
Right.
But I think we can figure that out. So we have take some of those people who have that desire,
Yes.
who already have some medical knowledge and background, and push
Yes.
it out there.
And especially if they're going to address patients who are in need.
That's right.
So maybe not necessarily rural medicine, but geriatric population.
Exactly. And
We do have a silver tsunami ahead of us, and actually we're probably in the midst of it.
Yeah.
And we need to address it.
Let's increase that number. I think
Yeah.
there is a way. I look at the nurses at Henry Mayo Hospital, and I know several in the emergency room. They're in the wrong field. They need to be doctors.
Yeah.
They're practicing what they want to practice. But I've talked to several, and one is a nurse practitioner now. She got her degree, but I just think that easily a little bit more education, she could be an MD. And
That's right.
we need to start doing that in our
Yeah.
society. But these are simple solutions that need to be cultivated in some way with understanding of the finances and the time factors and things like that. But it can be done with common sense.
Right.
But we're not seeing a lot of common sense in government right now.
No.
And because we're not, it's a sad issue that who suffers? It's those people who are sitting in line in the emergency room,
I know.
who are 80 years old
I know.
with chills and shakes, and they're not getting the care that they need.
I know.
That's
Oh,
right.
it
And
just breaks my
that's
heart.
interesting with nurses who go through a certain amount of education and they're very knowledgeable. What's wrong with adding a couple more years of actual schooling? Yes.
The only
To,
difference
to
between
get them that extra degree so that they can practice.
the difference is that with nurses, they're taking orders, and
Right.
but their recognition evolves and develops during the time that they're practicing.
That's
The
right.
only difference that you have to add on is for them now to recognize and make decisions, to
Right.
give the orders.
Right.
How hard is that? It takes a little bit of time.
Right.
And
Right.
yeah, you do. I think it's important that you get that training that raises the bar and keeps that bar up there. It is sad right now what you said, Barb. We're seeing more people in the emergency room as PAs and nurse practitioners, and I'm nothing against that, but I will tell you, I can walk into being in an emergency room, and this is where I practiced at one time early in my career, and I now can recognize somebody who needs my assistance immediately.
Yep.
That if I'm not there in a few minutes, they're
Yeah.
going to die.
Yeah, you can
And
literally
I-
just walk down the hall and see which patients are.
And I can't
Are
tell
truly
you
engaged,
how many physicians and nurses get to that level.
Yeah.
And but you have to give that to them. And if you don't have the training programs, and now the training programs are getting limited, we are truly healthcare-wise going in the wrong direction. But going back to the having geriatric emergency rooms, we at Henry Mayo, I know that when there's a patient in the emergency room who is in distress, somebody is out there already. Somebody is bringing them in, finding a bed, doing an EKG. If it's a stroke or things like that, they get in immediately. And realize 80% of our our patients are geriatric
Right.
that are admitted.
Right.
So, and we don't have pediatrics at Henry Mayo.
Oh,
So,
really?
look at your look. I mean, we can see pediatrics in the emergency room, but if there's admission necessary, they're being transferred out. We don't have a pediatrics.
I had
We
no idea.
used
Well,
to-
then
MS1 used to be.
why don't we increase the geriatric section then
Well,
instead of it?
Since
they don't have
there's so many
pediatrics.
now. We're so overwhelmed within
know.
the system that because of the Affordable Care Act, people do have insurance, but it's not being used wisely because we don't have the providers necessary
On the outpatient side.
on the outpatient
Yeah.
side. They're not. There's nowhere to go for them.
Right.
We're both physicians. We have to be able to anticipate a side effect, a complication, a problem with our patient when we're doing surgery or giving a medication.
Right.
Government doesn't do that.
No.
Government doesn't look at the ramifications of what happens. People vote in Britain and they realize, maybe I made a mistake. Hello, it's not that easy to rectify. You've taken this drug, you've done this test, it's done. You've done this surgery, you are done. So these are endpoints that, as doctors, we realize we need to make sure that we're looking ahead. Government doesn't look ahead, and they didn't in this case. So it's a bad sign for us, and some rational thinking, I think, could improve things. But are we going to see that? And I don't have the trust and confidence. I do in my colleagues. And our colleagues, are well educated and have a high bar for treatment and skills. But right now, our society and our system and government does not do that.
Yeah.
And not to be critical, because I think that we have a system, but in some areas it's molasses, and it moves too slow for what the rest of our society's needs are.
So how, Jean, would we start something like this?
Yeah.
Not necessarily a movement, but some type of research to be done.
I think you first have to, like they did in New York, I think you have to establish that there is truly a need for this, and you have to pull out the statistics to show that. And I'm sure they have done that there, but realize hospitals and emergency rooms, they're different. We have VA hospitals, we have HMO hospitals, we have some secular and religious hospitals, we have
Some for-profit, some non-profit,
Right,
and
exactly.
we've got a big mix.
Whoa.
So we don't, you have to then see what the clientele is like, and what
Yeah.
your ratios are. Children's Hospital won't see geriatrics, so you're done with them. So we
Well,
can figure out for others.
That's logical.
Yeah, we can, but I don't know if government would. Can you not see that they would apportion some monies for Children's Hospital for geriatric care? Because government is just that way. It sounds foolish, but it's logical. But for some reason, I just see that as a possibility is happening. But everybody's
look at the number of aging politicians. I mean,
Yeah.
don't they get sick?
They get
and if they do, they get absolute top quality treatment right now.
They never go on Medicare, which is a whole different topic, of course.
Oh, let's don't go there.
They don't go on
they don't?
Medicare. Nope. Politicians are not on Medicare.
No, they have their own.
They're writing the laws and making laws and passing the laws for Medicare, and none of them are on Medicare.
That's right.
Mama, you didn't know.
I didn't know that.
Yeah,
No.
that's a huge thing in our society. But
Yeah.
something else to think about as we go into our next segment of the show and take a break from this one. We're talking with Mama, who from Holy Cross, and I'm from Henry Mayo, and this is just a great conversation, Barb, that I think needs to continue. We're going to take a break right now on your hometown station, AM 1220 KHTS.